Hi everyone, my name is Davina Liggins and I'm with Healing Made Whole. And I just wanted to come today to you to talk about a very serious matter. So as many of you may be aware, in many countries, there is a phenomenon happening of excess deaths. And these excess deaths are occurring in many different categories. It's all causes of death or increase, and this is impacting all groups of people in all age groups. So many people are trying to figure out what is going on. The excess deaths above what is expected is happening at the tune of about 12, 14, 16% above what is expected. And they're not sure what is leading to that. Many people are speculating that it has to do with the lockdowns and inability of people to get proper screening and preventing or stopping adequate treatment early on, like early detection and adequate treatment. So, and there's likely other many reasons going on. But what I would like to put a pin on is that I think something has been lost in, especially the United States of America, and that is the whole notion of preventative medicine or preventative care. And certainly with at the individual and family and community level, most of us don't live our life anymore such a way that it prevents disease. Given the onslaught of processed food, poor lifestyle habits, inadequate sleep, lack of exercise, inexposure or lack of exposure to the sun, other modalities that we know are very important that foster healing in the body have been lost. And so what I would like to offer to you is that one of the biggest lessons that we learned from the COVID pandemic is that baseline health is very important. And what if we come into another situation where our healthcare system is shut down again and people are not able to get access to treatment, to early prevention or early detection? So are we just supposed to continue in this path? And I say no. I say as individuals and as families, we come together and we really understand that we have the power to prevent a lot of these diseases that is going on out here just by making some lifestyle changes. And I want to call out what some of those diseases are. Most cardiovascular issues dealing with the heart, as well as heart attack and stroke, even dementia, even the autoimmune diseases, the progression of them, and even in some cases, the initiation of them. Also, cancers. Oftentimes we don't see cancer as a lifestyle disease, but it really is. And I want to give you an example of that. For example, type 2 diabetes. Individuals with type 2 diabetes have a much higher risk of breast cancer, colon cancer, kidney, liver, pancreatic cancer. And guess what? Individuals with prediabetes also have a high risk of these same cancers and even others. And the reason why is because of the insulin pathway. When that insulin pathway is not in order, it is not cyclic. Insulin is supposed to go up and come down and go up and come down as we eat. And as we don't eat, it comes down. If it stays chronically high levels of insulin promotes cancer. Why? Because it's a growth hormone. It's a growth stimulating, growth promoting hormone. So it is completely understood at the biological level why individuals with high levels of insulin, and even which leads to insulin resistance, and there's many disorders that come out from that, end up with cancer or have a higher rate of cancer. So a lot of these disorders and diseases that we're dealing with can be stopped. And there's a rule of thumb that an ounce of prevention is worth a pound of cure. So if we prevent diseases from starting in the first place, we'll be better off as a community. And if another situation happened where we can't gain access to a medical care system, then we'll still be okay. And I like to say that early detection is not prevention. Just because you detected something early, it still exists. I'm talking about prevention. So, you all take great courage. Realign your lifestyle for health and not disease. All right, take good care, and I'll see you all the next time.